Member for Saanich North End Islands.
Thank you, Mr. Speaker. In response to the death of a 12-year-old girl recently, especially young casualty of the poison drug supply, this government and the official opposition are advocating to bring back a bill that would involuntarily restrain youth. The death of this young child is tragic. No one in this province should die from a poison drug supply, especially a child. In the wake of this tragedy, we feel the weight of this toxic drug crisis even more. But let's not use this tragedy as cover for inadequate policy. Restraining children against their will, as written in last summer's Bill 22, would cause significant and disproportionate harm, especially to Indigenous youth. Bill 22 is a reactive policy to an inadequate system of care and sets up youth for further alienation. What we should be doing is setting up a proactive mental health care system that ensures everyone can get the help when they need it. What is needed is a culturally appropriate, youth-specific, youth-friendly, voluntary detox, intensive care, management, day treatment, and community residential treatment system. My question is to the Minister of Mental Health and Addictions. Will the Minister resist calls to bring back this flawed legislation that has the potential to hurt more than it may help?
Premier.
Thank you, Honourable Speaker, and I appreciate the position of the member, but I profoundly disagree with it. Judy Darcy, the first ever Minister of Mental Health and Addictions in this country, worked tirelessly with all corners of this House. Jane Thornthwaite, former member from North Vancouver Seymour, former chair of the Children and Youth Committee, worked collaboratively to bring forward something. For the Green Party, perfection is always the enemy of progress. We had a youth die from opioid overdoses this week, and still the Green Party believes we should continue to flounder around rather than coming together collectively and never letting this happen again. I don't know how you can hold that position, member, after what we've just seen.
Member for Saanich North End Islands on supplemental.
Well, it reminds me of last summer, conversation that we had. Bill 22 faced strong opposition, and yet it was politicized. It was the BC Greens, just as we saw here today. The BC Greens were the ones that were standing up against this bill. The BC Greens, and as I said to the Premier in his office, were only raising the significant concerns of a wide variety of stakeholders that were speaking out against Bill 22. But yet, only the BC Greens were the ones that were speaking out against that. Let's Chief Coroner Lisa Lapointe. Our Chief Coroner, quote, serious unintended consequences, including the potential for an increase in fatalities. Premier won't mention that. The Chief Coroner said that this bill might negatively impact the work being done to reduce fear and stigma, something that we've been talking about in this session of the legislature. The representative for children and youth, not being brought up in question period today. The representative for children and youth, only the Green Party were standing in the way of it. No, the representative of children and youth said they are disappointed by government's move to create involuntary stabilization units, stating the need for more urgent voluntary supports. The Premier's government not only heard from the Green Party, but they also heard, and the Chief Coroner and the representative of children and youth, but also the First Nations Leadership Council, the Nurses Association, the Union of BC Indian Chiefs, that this bill faced strong opposition because, as it was written, it was not the solution to the problems that we face and could potentially make the situation worse. And that's exactly the advocacy that we brought to the Premier's office last summer. My question is again to the Minister of Mental Health and Addiction. Is her ministry focused on expanding the voluntary supports, or are they going to bring back the flawed bill that they put in front of this House last summer?
Premier.
Thank you, Honourable Speaker. And I was a 12-year-old drug user, and I wasn't reading statutes at the time. I don't think that anyone who's using drugs as a youth is concerned about the debates in this legislature. I don't think the parents of children using drugs are particularly concerned about the debates in this legislature. They want all of us to get our act together and protect young people. The direction to the Minister of Mental Health and Addictions is to consult, and she has been doing that. We will bring back the bill, Minister, and may well be an improvement in his eyes, but I reject his position that we have to find perfection before we step in and help people who need help.